Hi, everyone, welcome to my YouTube channel. It's all about the respiratory therapy, and in today's lecture, we're going to learn pulmonary function tests. Firstly, don't forget to subscribe my channel and hit the bell icon. You don't have to take screenshots of each slide. Just go to my Instagram from the link in description below and DM me the title of topic you need slides of. Pulmonary function tests, PFTs, are a group of tests used to measure lung function, airflow, and gas exchange. These tests help diagnose and monitor respiratory diseases, such as asthma, COPD, and restrictive lung diseases. The three main types of PFTs include spirometry, measures airflow and lung volumes. Lung volume measurements, determines total lung capacity. Diffusion capacity, DLCO, assesses how well oxygen moves from the lungs into the blood. Indications for PFTs. PFTs are recommended in the following situations. A. Diagnosis of respiratory disorders. Chronic obstructive pulmonary disease, COPD. Asthma, to check for reversible airway obstruction. Interstitial lung diseases, e.g., pulmonary fibrosis. Restrictive lung diseases, e.g., scoliosis, neuromuscular disorders. B. Assessment of disease progression. Monitoring progression of lung diseases, such as COPD, pulmonary fibrosis, and cystic fibrosis. Evaluating response to treatment, e.g., bronchodilators in asthma patients. C. Preoperative assessment, before major surgeries, especially lung or heart surgeries, to evaluate lung function and predict postoperative complications. D. Occupational and environmental exposure. Evaluating lung damage from exposure to asbestos, coal dust, chemicals, or smoke inhalation. E. Disability and legal evaluations. Used in workers' compensation claims for respiratory conditions caused by workplace exposure. Contraindications for PFTs. While PFTs are generally safe, they are not recommended in certain conditions. A. Absolute contraindications. Recent heart attack, myocardial infarction MI, within 1 month, due to risk of cardiovascular strain, uncontrolled hypertension. Severe cases may lead to complications. Pneumothorax, collapsed lung. PFTs could worsen the condition. Recent eye surgery, e.g., cataract or retinal surgery. Increased pressure during forced breathing may cause complications. Hemoptysis, coughing up blood of unknown origin, may indicate serious underlying conditions. B. Relative contraindications. Severe dyspnea, shortness of breath. Patient may not tolerate the test. Chest or abdominal pain. May prevent proper effort during tests. Recent upper respiratory infection. May cause inaccurate results. Spirometry. Spirometry is the most common PFT used to measure lung function and airflow limitation. It assesses how much air a person can inhale and exhale, how fast they can exhale. Parameters measured in spirometry. Forced vital capacity, FVC maximum amount of air exhaled forcefully after deep inhalation. Forced expiratory volume in 1 second. FEV air exhaled in the first second of forced exhalation. FEV/FVC ratio. Helps differentiate between obstructive and restrictive lung diseases. Peak expiratory flow. PF fastest airspeed during exhalation. To perform spirometry patient preparation. Explain the procedure to the patient. Ensure the patient is seated, relaxed, and wearing a nose clip. Breathing maneuver. Instruct the patient to inhale as deeply as possible. Place the mouthpiece in their mouth and form a tight seal. Ask them to exhale as forcefully and completely as possible into the spirometer. Repeat at least 3 times to ensure accuracy. Interpretation of results. Compare values to predicted normal values based on age, gender, height, and ethnicity. Obstructive pattern, e.g., COPD, asthma, FEV, FEV/FVC ratio. Restrictive pattern, e.g., fibrosis, obesity, FVC, normal or FEV/FVC ratio. Small blue diamond example interpretation. A patient has FEV of 50% predicted and an FEV/FVC ratio of 60%, suggesting moderate airway obstruction, likely due to asthma or COPD. Lung volumes measurements. Lung volume testing measures total lung capacity, TLC, residual volume, RV, and functional residual capacity, FRC. These tests help diagnose restrictive lung diseases like pulmonary fibrosis. Methods to measure lung volumes. Body plethysmography, gold standard. Patient sits inside an airtight chamber, plethysmograph. They breathe through a mouthpiece while small pressure changes are recorded. This calculates total lung capacity, TLC, and residual volume, RV. Methods to measure lung volumes are as helium dilution and nitrogen washout, alternative methods. Patient breathes a known concentration of helium or nitrogen. The change in gas concentration helps estimate lung volumes. Interpretation of lung volume results. Increased RV and TLC, seen in obstructive lung diseases, COPD emphysema, due to air trapping. Decreased TLC and RV, seen in restrictive lung diseases, fibrosis, scoliosis, obesity. Small blue diamond example interpretation. A patient with TLC of 60% predicted and RV of 50% predicted likely has a restrictive lung disease. Diffusion capacity of the lung for carbon monoxide, DLCO. DLCO measures how well oxygen passes from the alveoli into the blood. Steps to perform DLCO test. The patient inhales a small amount of carbon monoxide, CO, mixed with oxygen. After a breath hold of 10 seconds, they exhale into the machine. The machine measures how much CO was absorbed by the lungs. Interpretation of DLCO results. Low DLCO. Indicate impaired gas exchange, e.g., pulmonary fibrosis, emphysema, pulmonary hypertension. Normal DLCO. Normal lung function. Small blue diamond example interpretation. A patient with DLCO of 45% predicted and normal spirometry may have early interstitial lung disease. Spirometry detects airflow obstruction, e.g., asthma, COPD. Lung volumes assess restrictive versus obstructive patterns. DLCO measures gas exchange efficiency. These tests help diagnose, monitor, and guide treatment for respiratory diseases. Thank you. See you in the next lecture. These are the basic lectures of respiratory therapy. We will move towards in-depth of each topic in lectures ahead.